Hi, everyone. Thank you for joining our podcast. I'm Ashley Daza, a marketing analyst for the Cigna dental business. Today, I'm joined by Dr. Carrie Sun, Cigna's Chief Dental Officer. Thanks for being here today, Dr. Sun.
Thanks, Ashley. Glad to be here.
So today, we're going to be talking about updates on COVID-19 and our dental health. Although a lot of us may be anxious for more information, there's also undoubtedly a lot of questions, concerns, and nerves. I'm hopeful that by talking with you, a trusted clinical professional, we can help alleviate some of those questions and concerns and provide clarity on a few very important topics.
Absolutely. We can all get information overload these days with so many sources out there. And it's hard to know who to listen to. It's very important to make sure we're receiving information from credible sources, and I'm hopeful I can provide a source of truth by addressing some common questions.
Great. So first, I'd like to talk about oral health impact and COVID-19 severity. Is it true that gum disease has been linked to COVID-19 complications?
Yes, there's been a new research study that's been published in the February 2021 Journal of Clinical Periodontology, and it found that COVID-19 patients are at least 3 times more likely to experience complications if they also have gum disease.
Wow. And this isn't surprising since gum disease is linked to so many other health conditions too. After all, our bodies are interconnected and our oral health is linked to our whole person health. What else did the study reveal?
That's right. Unfortunately, it's not surprising. The study of more than 500 patients with COVID-19 found that those with gum disease were 3.5 times more likely to be admitted to the intensive care unit, 4.5 times more likely to need a ventilator, and almost 9 times more likely to die compared to those without gum disease.
Those are startling statistics, especially that those patients with COVID-19 with gum disease were almost 9 times more likely to die compared to those without gum disease. What are some of the other factors here?
There are several possible factors that come into play, but inflammation appears to be the big one. In this study, blood markers that indicate inflammation in the body were significantly higher in those COVID-19 patients who had gum disease compared to those who did not. And this suggests that inflammation may explain the increased complication rates.
Is it normal for someone with gum disease to have high levels of inflammation even without COVID-19 present?
Yes, gum disease, the formal term is periodontitis. It's an infection of the tissues that support our teeth, and if left untreated, the toxins from the bacteria will stimulate an inflammatory response. The Journal of Clinical Periodontology study reported that in combination with COVID-19, the inflammatory response may be life-threatening. And the study also considered other factors that might be associated with COVID-19 complications, such as body mass index or BMI, smoking, asthma, heart disease, diabetes, and high blood pressure. And after adjusting for many of these other conditions, gum disease is still associated with COVID-19 implications.
I'm glad you brought up the other factors. Those are also really important to mention. The good news about gum disease is that it can be prevented and treated. What are some measures that we can all take to prevent gum disease or maintain gum health?
There are many things that we can do. Probably these are going to sound familiar, but very important. Visit your dentist regularly. Your dentist is the best at checking your gums for signs of disease and will provide the right treatment that you need. And we all know that we need to brush our teeth carefully 2 times per day and 2 minutes each time. And you can use either a manual or a powered toothbrush, whichever helps you get to all the surfaces of your teeth. And don't forget to use a toothpaste containing fluoride. And look for a toothpaste with the ADA seal of acceptance if you're unsure. And one of the hardest things to do is clean between our teeth and using floss or an interdental brush. And then to reduce bacteria that cause tooth decay and gum disease, talk to your dentist about specific mouth rinses or toothpaste that may be helpful for you.
Those are great tips, and definitely we can all use a reminder even if we already are doing some of those things or all of them. Aside from oral health tips, do you have any additional general tips that go hand in hand?
Yes, of course. Although these may not sound like oral health tips, these are just as important because it talks about our whole person health. Do not smoke or use tobacco products of any kind. Those have high connections with oral health and disease. Maintain a healthy weight, eat a balanced diet, also exercise and try and reduce your stress. And also make sure to see your medical doctor as recommended to really check for and manage chronic conditions, like diabetes that are highly connected to our oral health.
That's helpful. Thank you. So moving on to our next topic, I'd like to talk about dental practices and COVID-19 safety. Are dental offices considered safe and effective in preventing the spread of COVID-19?
Yes. In fact, the study within the Journal of the American Dental Association found that 99.7% of dental practices have implemented enhanced infection procedures. And along with that, less than 1% of dental professionals reported having either confirmed or probable diagnosis of COVID-19.
That's reassuring to hear that less than 1% of dental professionals report COVID-19 positivity. What are some of the safety measures dental practices are taking to implement enhanced infection procedures?
Measures taken by dental practices include following the CDC's infection control guidelines, screening patients for COVID-19, social distancing. Offices also placed barriers in their offices to help keep patients separated, and then using personal protective equipment like face masks, just to name a few. These efforts really seem to be working well.
That's great to hear that all of these efforts are working. Is this the first study to estimate the prevalence of COVID-19 among U.S. dentists? Initially, it was assumed that because of the nature of the work, examining and treating people's mouths, teeth, and gums, dentists were at an increased risk of infection due to their close proximity to patients.
You're correct. Dental offices are exposed to procedure-generated aerosols. This is the first study, though, and it's wonderful to receive confirmation really that dentists have followed the guidelines issued by the CDC and are safe, as well as the patients they're treating.
Definitely. That's huge. It also speaks volumes about dentists and their office staff and just how seriously they're taking safety measures and protocols to make sure that they can continue to provide treatment to their patients.
I agree. Safety measures in dental practices are always crucial, but enhanced safety is really needed with COVID-19. Hopefully, patients out there will understand how seriously it's being taken and really are starting to feel more comfortable going to see their dentist because dental care is really vital.
Absolutely. I know I personally feel better and safer knowing of these newly released statistics and the supporting study. As we mentioned earlier, dental care is imperative because there's such a strong connection between gum disease and other systemic diseases like diabetes and heart disease, just to name a few.
Yes, and add in the supporting evidence that periodontal disease could predispose patients to more severe COVID-19 symptoms, and it's even more important right now. Many dental practices have reported that their patient traffic has never been greater, so people seem to be getting the message.
Good, and this is just yet another reminder for all of us. It's so important to maintain healthy teeth and gums, especially during a global pandemic. So I better go make sure I have my next dental visit on the calendar.
That is a great idea.
So now moving on to the final topic, there's been word that dentists are able to administer COVID-19 vaccines in some states. Is this true?
Yes, this is true, and the American Dental Association supports recognizing dentists as COVID-19 vaccinators and really has been encouraging this at many levels from the country to at the state level.
That's great. What else can you tell us about this?
I'll keep it short because it is different for every state, but the ADA and many of the state dental associations have been advocating for dentists to be able to administer vaccines. We are seeing that about 20 states currently allow dentists to do so, and this should help improve public vaccination rates. It'll grow the network of people that can administer the vaccine and really hope to limit the spread of COVID-19.
Absolutely. How can we find out which states are allowing dentists to administer vaccines?
The ADA has developed an interactive map that really details dentists' ability to administer the vaccine by state, as well as the phase that that state is in terms of the vaccination plans. You can visit the ADA website to view their interactive map. And in addition, those states that haven't yet passed the legislation, the ADA has developed principles to help state associations advocate for that expanded scope of practice.
Great. And hopefully, with the support of the ADA and state dental societies, more and more states will continue to grant dentists the opportunity to administer vaccinations. And in the meantime, thank you to all of the dentists who have already risen to the challenge.
That's right. Dentists play a huge role in providing overall health care, and administering the vaccine is just another way that dentists contribute and make a difference and help increase vaccination rates.
I agree. We're all helpful for brighter days ahead, and I've enjoyed learning so much from you today, so thank you, Dr. Sun. I personally feel much more informed and, as a result, more at ease. As we mentioned earlier, there's just so much information out there, so I appreciate you talking to someone who can provide reliable answers from dependable sources. And to our audience, we thank you for listening in, and we hope that you also learned a lot. To learn more, you can visit the Coronavirus Resource Center on Cigna.com.
This information is for educational purposes only. It is not dental health or medical advice. Always ask your doctor for appropriate examinations, treatment, testing, and care recommendations. All Cigna products and services are provided exclusively by or through operating subsidiaries of Cigna Corporation.